I'm delighted to welcome our next speaker, David Pencheon. He's a UK-trained public health doctor and is currently the director of the NHS Sustainable Development Unit, England. David has worked as a clinical doctor in the NHS, a joint director of public health training programme director in the east of England, and with the NHS Research and Development Programme, and in China in the early 90s with Save the Children. So here to talk to us about sustainable development in the public sector, NHS, progress, challenges and opportunities. Please give a warm welcome to Dr. David Pencheon, who's limbering over there.
Is it this one? Okay. Well, thank you. That's great. And I'm going to talk with you, to you, for about 15 minutes. I'm going to try and make it very quick, and I'll apologise for, I won't apologise for going through the slides quite quickly, because what I'd really like to do is to hear your questions and your reactions to what we're trying to do. I think what I'm trying to do in the NHS, has everybody heard of the NHS? It's a large organisation. Is trying to do what you're doing in the sort of higher education sector. And I think there are some huge analogies. And Andrew Smith, who some of you may know, who works at HEFCE, I've talked to a lot about this. So all I'm going to do is just tell you what we've done in the NHS. And what I want you to do is to say, hey, you could be doing it so much better, or, wow, that's a neat idea. How did you get that done? So I'm not really going to talk about health and climate change and malaria and all that. I want to talk about large-scale change, how you change an organisation, or how you help an organisation change itself. Is that all right? You happy with that? Good. Nice to know you're in the right room. Okay. So in terms of sustainable healthcare, I just use the Brundtland definition like that. And one of the, I tell you, I'll just go through lots of lessons I've learned, some of them good and some of them bad. One is, you'll never get anybody to do anything more sustainably unless it aligns with their current philosophy. They're not going to say, oh, I'm going to stop doing this, I'm going to start doing sustainable development. That's just pie in the sky. What you can do, though, is to say, you know, you can do your job better by doing this, this, and this. Oh, and by the way, it happens to be more sustainable as well. Isn't that a great icing on the cake? So there's a very important lesson. People never do things sustainably, and where sustainability is the prime thing. So in terms of current global drivers in healthcare, there are things that you would recognise, like demographic changes, long-term conditions, changing expectations. When you go to hospital or see your doctor, we have very different expectations of what we receive than we did many years ago. But the phrase that I think is very important, very powerful, is one the business sector uses a lot, which is triple bottom line. How many people have heard of the phrase triple bottom line? Oh, God, you're so smart. I'm going to skip most of these slides, actually. So I won't... I should be asking you. You should be up here. I should be sitting there. You should be studying. So that sort of thing, which in a sense looks like you know, the classic thing. You know. Now, just get these out of the way very quickly. As far as health is concerned, whenever you talk about health and climate change, people always think you're talking about, you know, gastrointestinal diseases, cataracts, dengue fever, sunburn, all that sort of stuff you're familiar with. In fact, it's not like that. It's much more like crop failure, economic collapse, migration, civil disorder, and what's that last one? What's that last slide? Extinction. Yeah, it's just total. I mean, what happened on Easter Island? If you don't know what happens on Easter Island, and if you want to know what we're doing at the moment, just go and read Jared Diamond's book on collapse and read that chapter on Easter Island, because it's a perfect analogue of what we are doing now to the globe. You know, we're just sort of trashing it, essentially. And interestingly, the second lesson is you've got to have data. If you want to change, I mean, change is essentially, in most organisations, most people, an emotional affair. It's not a cerebral affair, it's an emotional affair. But you do need good data. You do need data. And I just want to show you some examples of data that, in our experience, has changed things in the health service, and data that hasn't changed things. Now, this happened in 2003. There was a big heat wave in Europe. You may remember it. Actually, not 30, but nearly 60,000 people died. A lot of them died in Paris. They died because they were left alone by their relatives. It was environmentally caused, but it was essentially a social disaster. And that's the second lesson, which is there are no environmental solutions to environmental problems. There are only social, political, economic solutions to environmental problems. A very important lesson I learned was around, in the United States, air pollution is quite strictly legislated, and they've done it very, very successfully. One of the reasons they've done it is because they didn't make air pollution an environmental issue. They made air pollution a health issue. If you make something an environmental issue, it sort of parks it over there. That's a very interesting articulation of an issue. So there's a very interesting lesson. I'll give you a list of words we avoid in the work I do in the health service. Environment and planet. I'll show you some more words we don't use. Because what we try to do is stay focused to what the health service is there to do, which is to deliver high-quality health care. People who deliver high-quality health care are not interested really in sustainability. They are interested in it if it helps them do their core job better. And I want to point out some analogies. So first thing is data. But the other thing is about using numbers. Many years ago, I used to be a maths teacher before I was a doctor. And one of the things I learned helping kids learn maths is that most people don't understand numbers less than a half or more than about 25. Okay? So don't even bother. If you say 60,000 people or 20,000 tons of CO2, you might as well, it just doesn't mean anything. You've got to say a city the size of Leicester would be wiped out every 3 weeks or whatever it is. You've got to make it graphic. I mean, Stalin said that 1 death is a tragedy, 10 deaths is a disaster, and 1,000 deaths is a statistic. So 60,000 deaths doesn't mean much. So you've got to articulate it in ways that really engage people. And that's the issue about engaging people, is listening to what people are minded to do. And one of the big things that we've tried to do in the health service is to get this thing right between doing the day job more efficiently, try and do what you do today more efficiently, and something else which is you're probably very familiar with, which is transforming it. Now, lots of things we do more efficiently. We move more efficiently, we buy stuff more efficiently, we use energy more efficiently. But when we transform things, and when we need to transform things, we've got a legal target, as you know, in this country of 80% by 2050. We're not going to do that by changing just light bulbs. Light bulbs is a great place to start. It's a fantastic entry point because it saves money. But that's not going to be the solution. That's not going to be the final thing. It's about how you use small changes to make transformational change. And by transformational change, I mean completely changing your business model, whether it be of healthcare or selling shoes or delivering education to a particular age group. Change it completely. And if we've got time, we'll talk a little bit more about this. I used to work in China for a few years, and one of the interesting things about the healthcare system in the part of China I worked is that you paid your village health doctor when you were well and stopped paying him or her when you were ill. Now you think about it, what that does is incentivizes the people who provide healthcare to stop people getting ill. In this country, we pay hospitals for doing operations. Now, strange as it may seem, if you pay somebody to do something, they'll do more of it. Funny that, isn't it? Strange. Anyway, the third lesson is follow the money. Money matters. And one of the things I did last year was to work with some colleagues, including Nick Stern, to look at the economic value of addressing climate change. Not because it's an ethically good thing, not because it will save the planet, because it's good for the business case. And you have to get these things written, you have to do the research, you have to produce the data, but importantly, you have to engage people who are going to make decisions like policymakers. And there's just an example of the triple bottom line in the healthcare system. Now, the fourth thing we did was to measure the carbon footprint of the health service. It's the largest Scope 1, 2, 3 corporate carbon footprint in the world. We did it with the Stockholm Environment Institute, and we've done it 3 times. We've done it every 2 years for the past 6 years. And what it does is that this sort of thing puts most policymakers to sleep. But you have to do this because you need the data when you're challenged. And what it does show is that, in fact, we've reduced the carbon footprint. This is amazing. The carbon footprint of the NHS in England has reduced by 1%. after being on an incredibly high trajectory. Now, that's nothing to do with me. It's probably due to the recession. But it's very interesting that if you and when you measure it, you realise something which you all in this room know, that, and I'm sure Procter & Gamble went on about this yesterday, that most of the stuff is in what you buy. It's not the energy, just the energy you use or the travel we do, or it's what we buy. And interestingly, a large part of that in the health service is pharmaceuticals. And that leads you on to another principle, which is the pharmaceutical industry is very keen to reduce their footprint as well, because they're being taxed on it, and helping the pharmaceutical industry change their business model, not making it more efficient, but transforming it. And an example of that is that trying to get the pharmaceutical industry to move from a product-based service, I manufacture pills and I sell them to you. We pay, I don't know, £20 billion for pills in the NHS. I mean, eye-watering amounts of money. Change it from a product-based industry into a service-based industry where you try and convince pharmaceutical companies, for instance, to manage people with diabetes. You say a contract to say now, if you do that, they're very heavily incentivized to move upstream, backstream into prevention, which is a much more sustainable way of managing health. I'm trying to think of the analogies for higher education, and I guess you're doing that as well. You can measure the potential reductions, and what this rainbow graph really shows is that there's no magic bullet, and that's the fifth lesson. That when people say to you, shall we do this or that? Is it a top-down approach or a bottom-up approach? Is it energy or is it behaviour or is it legislation? Well, it's everything. There are no ors in this business, it's ands. We have to work right across the patch. And that makes it very difficult to do because we naturally have our own comfort zone. I mean, you'll have your own comfort zone about energy or about travel or about human behaviour or about rules and regulations and governance. The issue is, it's all of those things together because no one is a magic bullet, and we've shown that within one large sector. I won't go on about that, I'll leave that. The sixth lesson is something which relates to what I said originally. You've got to find things which are attractive to what people are doing already. And there's a great benefit for the healthcare system. I don't know what it's like in education and higher education, but in health, there's a really well-known maxim that's what's good for adaptation and mitigation of climate change is also good for health and healthcare. Now, not in the future, now. And you've got to find some really important quick wins to engage policymakers to make it core to their job. Not a nice thing to do, not greenwash, not something that makes them feel smug or good, but something absolutely core to the business case of what the organisation is trying to do. And just to give you an example, or three examples in healthcare, or two possibly, if we have more physical activity, if we have a better diet, eat more fruit and vegetables and less processed red meat, if we move our bodies, never in the field of human history have we moved our bodies around the world without moving our bodies. Never have we moved so much without using our muscles. And that's why we have an obesity epidemic, which is leading to a diabetes epidemic, which is leading to a coronary heart disease. So all these things are very much in the interests of our core business. That's for the health of the population. But actually for the healthcare system, it's good as well. Because if you think about, there's a hospital system in America called Kaiser Permanente, which runs, it's a bit like a miniature NHS. It's the largest healthcare provider in the US. But they have a business model there where they say, any patient which gets into any of our hospitals is a sign of system failure until proved otherwise. It's a sign of system failure and financial failure until proved otherwise. And what they mean by that is that it's not in their interest, it's not in the patient's interest to get into hospital because the vast majority of things that you see in a hospital have a high degree of preventability. And even if you go into the hospital here in York, and I'd take you around a ward, I could show you almost in every patient that could have been prevented, that could have been alleviated, and a lot of healthcare we deliver is the result of us screwing up somewhere else in the system. It may be people's behaviour like diet or exercise. It could be people not gritting the road. It could be a failure of the education system. It could be alcohol, tobacco, it could be broken families, it could be lots of things. But healthcare picks up the failures, if you like. So it's interesting that if you economically incentivize a system to get the system to address what it's trying to do upstream, you can make it a much more compelling business case. It can produce the product in terms of health and do it in an environmentally sustainable way. Triple bottom line. And that's why we shouldn't worry that much about it. And you shouldn't always bang on about climate change. Because climate change is really boring. It's frightening. It's scary. People evoke the most powerful human emotion we have, the most powerful coping mechanism we have, which is probably denial. Denial is the biggest thing, at both at an individual level and at an organizational group level. One thing I would love to understand more, just like mass hysteria, is mass denial. Because if Martians were circulating the planet now, they would look down on us, and it would look to them as though we were enjoying high carbon lifestyles in half the world without understanding what we were doing. The Martians would say, wow, when they understand what they're doing, when they understand they're releasing 350,000 years of buried sunshine, boy, they're going to really change because they see they're on a hiding to nothing. And if they land and they open a copy of The Guardian, they'll see, bloody hell, they do realise what they're doing. They do, and they're doing tiddly-squat about it. Now, that's a really fascinating thing. Anyway, don't worry about climate change, because there are lots of good things we can do. No, I want you to panic, actually. I want you to go into denial. I'll just finish off by telling you what some of the drivers are that change organizations. So I want to try and make the analogy between the healthcare sector and the higher education sector. These are why, this is the, well, you can do this exercise. I'm going to show you 5 reasons why healthcare organizations take sustainability seriously. Some do, actually. Some are very good. And there's great variation, but some do. You're going to tell me what are those 5 reasons. Okay? You've got 15 seconds to do this. You may confer with a neighbor. What are the 5 reasons why a hospital or a health center or a laboratory might take sustainability really quite seriously? You've got 15 seconds, 5 reasons, in order, starting now. Okay, you got 10 seconds left. Everything for time. Are we okay for time? Okay, right, so you've had far too much time. What's the number one? If you get this number one reason wrong, you're in the wrong job. What's the number one reason? Money, yeah. Okay, I'll run through the others and see how well you do. The second is it complies with regulation. Never underestimate the power of regulation. No chief executive likes to be fired because they've broken the law. It's a very compelling argument to say, you don't have to discuss this at board level, it's the law. And they go, oh, okay, that's fine, but do it. Zip, do it. So use the law. We do have quite a lot of law. I mean, we're one of the only countries in the world that has a Climate Change Act, so use it. Thirdly, it improves resilience. Resilience is the healthcare system is good at resilience. We do resilience well. We're a whole bunch of crisis junkies in the health service. We love crises. We love blue lights and ER and white coats and drama. I mean, the problem with climate change is it's a slow burn emergency. So you got to frame it in a way that it's an emergency. Oh God, it's an emergency. So we love it. So you've got to find your language that engages the people you work with and say, hey, this is core to our business. Okay, fourth, enhances reputation. Now, universities are competitive. Did you know that? Just like people in the health service. So the reputation is very important. And the reputation of the health service is very important. And the serious issue here is that universities and health systems are seen as good things. So when good people do very little, bad things happen. That's an adaptation of Edmund Burke. So good organisations like universities have a very powerful responsibility to set an example to an incredibly influential cohort of the most influential young people in the country. I mean, bloody hell, that is incredibly important. So we all look, every single one of us looks for excuses to do less than we should do. And if you see your doctor doing nothing, you think, well, if it were that serious, then my doctor would be doing something. And we know that because in smoking, we never got the population levels of smoking down in this country until we got the medical profession to stop smoking. That's what we did. We didn't worry about the population. Get doctors, nurses to stop, well, nurses, we failed dismally. But, and it's terrible, isn't it? It's terrible. But doctors have stopped smoking. It's very rare to see a doctor smoking. And it's incredibly important because if someone sees a doctor smoking, they think, well, it's obviously not harmful. So when you see hospitals doing things like, give you an example, all parking in this NHS hospital is free, except if you drive a petrol or a diesel car. Okay? Make it positive, make it public, and make it press-worthy, because the press will jump on that. They would love that, and you get a lot of media attention. And then you have to cope with that, but assuming you've got the skills to cope with it, then do that. But you've got to do things that engage the public. The universities are essentially, whatever you say, they're public institutions in one sense, or publicly perceived. So if universities do nothing, you're doing bad things. Okay? And finally, this is what I always remember, number 5, remember what your core business is. It improves health. That's one thing that you've got to remember. Anyway, I'll just tell you the story we've about 4 years ago, we published a carbon reduction strategy. Just 10 things you can do. These are 50 things, 10 things in energy, 10 things in water, food, travel, procurement, legislation, workforce development, engagement, all sorts of things. Then what we did was you have to have a vision of the future, and it has to be positive. Martin Luther King did not say, I have a nightmare. You have to have a very positive vision about the future. So we told some stories about what healthcare could look like in 2030. And people said, God, that's somewhere I'd like to be. Because we're addicted to the present. Even with all the present failings we've got, we're addicted to the present. Then you've got to update the data. Now, this is the document. I bought one of these documents, so we'll raffle it later. This is a route map which shows you no matter where you are in the system, there's always something you can do. It doesn't matter whether you buy sheets or procure drugs or manage the combined heat and power for a hospital, or you're a professor of surgery. There's something you can do, and this is what. So there's something for everybody in this. It's so much fun. Something for everybody. And finally, what we did earlier this year, and I've got quite a few of these documents, so we don't need to raffle these. We did an Ipsos Mori survey, what the public think, because you'll never have large system change unless you've got some public mandate. So one of the reasons I'm in trouble is because I asked the public, we waste drugs in the NHS at an appalling level. We asked the public, would you accept drugs being prescribed to you that have been returned from other patients that were safety tested and properly packaged? And the answer was over 50% of the public would do that. Now that's very important because the reason we haven't been able to do that is because too many people have said, oh, that would never work. The public would never stand for it. So, well, have you asked the public? No. Well, you better ask the public. So you absolutely got to ask people because you need quantitative mandate to promote action. It's absolutely crucial. Don't guess it. Don't assume it. Ask people in a properly conducted professional survey and use that as a mandate, as a lever to get people thinking. You don't need to hector and finger wag and guilt induce and blame. You just need to say, look, this is what the data says. What do you think, Chancellor? You know, whatever the conversation is you're having. And what we found, which is something which is very akin to what the World Business Council for Sustainable Development found, is there are 3 levels of change. One on behaviours, that's both individual behaviour and organisational behaviour, and the relationship between. So students can massively change the behaviour of a university. If one student goes to see a dean, it means nothing. But if 3 go to see the dean, or 15, it does. Standards and innovation. That's the public opinion survey. Then we asked leaders whether it's important. So you asked at the top and at the bottom. And indeed, 60% of NHS leaders believe that sustainable development is essential to the successful running of their organisation. Then you have lots of examples, lots of little things like energy meters. You've all got energy meter at home, haven't you? Has anybody not got an energy meter at home? Stand up now. Oh, that's fantastic. You've all. Oh, these are really important things to do because they're just fun. They're fun and they save you money. How many people in this room have measured their carbon footprint in the last 6 months? Okay. You need to do that. You absolutely need to do that. We have no authority to stand up and talk about a sustainable future if we do not know ourselves what our own impact is. There's a bit of hectoring for you. Okay, so it is important to do these things. Travel, we've talked about travel. Commissioning. What's the commissioning? What's the purchasing power of universities? How much money do UK universities spend in the UK economy? 68 million. Sorry? 8 billion. Any other advances on 8 there? I mean, this is really important data to know, because if you know from the previous presentation, UK PLC, you get things into UK PLC, you get them into UK policy. So it's really important to understand and remember that. Okay, quiz question. Which country is that? The most advanced sustainable transport policy in the world comes from which city? Pardon? No. It might be very good. I mean, this is, but that's not this city. It's not Sheffield. It's not Copenhagen. It is Bogota in Colombia. Democratically elected mayor did this, stood on a mandate. The reason I'm showing you this is because a lot of the lessons about how we run a sustainable world will come from poor countries, troubled countries, what we call less resilient countries. But because they're less resilient, they know what they need to do to be resilient. So the problem is we have in the Western world is that we're isolated, smug, and insulated from the effects of our actions. If you live in a developing country, you certainly see what, climate change is not a future thing for a lot of people. It's happening now. You know what that is? That's how much of the deserts you need to cover. Do we know how to do it? We do, because your taxes have been spent doing it. That's decarbonising global electricity, which we absolutely have to do. So just finally, 6 of the lessons so far. This is a journey. So if you're taking the higher education sector, you've got to help people on their own journey. And do it by listening, engaging, and asking questions, not finger-wagging like I'm doing. Don't focus on the environment and climate change. Focus on money, governance, reputation, resilience. And if you're in the health sector, on health, but about education. Focus on win-wins, be positive. Communicating science. It's not just the generating of science, it's the communicating of science in real ways that make a difference to individuals that matters. And being honest. And embed it within governance. So what we've done is we've got all hospitals in the UK to report on sustainability as part of their financial reporting, not as a nice thing to do in an appendix for which you get a little green leaf star. It's part of financial reporting. Because if you don't do this, you're losing the taxpayer money. But that's about integrated reporting. And one thing I would thoroughly recommend is to get into integrated reporting as a legal requirement, for instance, for capital funding of any projects within universities. And work both on efficiency and transformation simultaneously. Okay, I'll stop there. Thank you very much.
We are running over, I'm afraid, but that was fantastic. I'll take a couple of really succinct questions and an equally succinct answer. So we've got a hand up there. Someone could run up there with a mic, and this person here. Yeah. So if you start, please, and then you're fine. Yeah. Keep your hand up so you can see.
You talked about moving upstream, which I think is a really interesting idea. Can you give any stories about projects you've worked on where you've gone upstream beyond your sort of immediate confines of the institutions you've worked in and gone to more sort of social?
Well, in the healthcare sector, I don't know how relevant it is for higher education sector. I don't know if did any of you know that NHS being reformed at the moment? Did you? part of the issue there at working upstream is you give the budget to GPs, and the logic being that GPs can manage a lot of things with their own budget in their own, so care closer to home, giving people control much more of their own health. Health sectors are very good at infantilizing patients rather than using the best resource we've got, which are people. So move the care upstream with money. Do it with the money. That incentivizes people massively. Even well-paid people are bizarrely incentivized by money.
Yeah. Thank you. And this question?
Go on, shout it out.
Basically, lots of us at the university teach the nurses and doctors that go to work in the NHS, and I just wondered, in terms of making sure it gets into their curriculum, either their services they normally talk about is there a way that we can work with you to make sure that that does happen, I suppose? It makes it a lot easier when it's coming from what they have to be taught. For instance, like engineering, they have to be taught.
Yeah. It's very logical, that, and there are lots of teaching hospitals around the country, which are joint university, medical school, hospitals. It's amazing how difficult it is to do that, and one of my real fears is the biggest barrier I have in the health sector is something you may have in the higher education sector, which is what I call moral offset. Because we work in good industries, we already do, you know, I say patience all day. You want me to save the planet as well? Yeah, it's almost as if, because we do good things, but absolutely, you know, we've worked with the General Medical Council, we've worked with the Faculty of Public Health to get this core into disciplines. But the reason I'm slightly reluctant to do that is what you really want to do is to get people to want to do it, not to drive. You've got to work out when is it time to be Stalinist and when is it time to let 1,000 flowers bloom. And you've got to be slightly careful about when you come on heavy and when you come on and say, like, everybody else is doing it and being successful, why are you choosing not to do this, or what? So I think you absolutely get it into the curriculum, and sometimes there's room to be Stalinist there, actually. You just make a law and you say that it's going to be done. Sometimes you need that to kick-start it, and then maybe 1,000 flowers will bloom when people do it better. But beware moral offset in public sector. It's a massive, massive barrier, and it's an emotional barrier which makes it even more powerful.
Please join me in thanking David.